sodium glucose cotransporter 2 inhibitor, namely SGLT2 inhibitor, is a new class of oral glucose-lowering medications by blocking the reabsorption of glucose in the kidneys. This leads to glucosuria, which not only reduces blood sugar but also offers many metabolic, cardiovascular, and renal benefits. Hello, I'm Dr. Wei-Cheng Zheng. I am currently an attending physician of the Taipei Veterans General Hospital and also an assistant professor in the National Yangming Jiaotong University, Taiwan. On behalf of our research team, I'm very pleased to present our original study that is published in the Mayo Clinic Proceedings entitled Excessive Initial Renal Function Decline Following Sodium Glucose Cotransporter 2 Inhibitor Treatment Predicts Major Adverse Cardiorenal Outcomes. Starting SGLT2 inhibitors often comes with an early reduction in kidney function, usually seen within 2 to 4 weeks after the treatment, with partial recovery by around 12 weeks. Although this initial renal function decline is usually regarded as a reversible hemodynamic effect due to tubular glomerular feedback, but when the decline is excessive, like more than 30%, the long-term safety and risks are still not fully understood. In our real-world study, we found that SGLT2 inhibitor users with an eGFR decline of more than 30% face progressively higher risks of major adverse cardiorenal events. These findings highlight the need for careful monitoring and timely interventions for these high-risk patients. Our study enrolled more than 4,900 diabetic patients and categorized them into 3 groups based on the maximum eGFR change within 12 weeks after starting SGLT2 inhibitors. The group were mild decline group with a change of 30% or less, moderate decline group with a change of more than 30% but up to 40%, and severe decline group with a change of more than 40%. We use Cox regression, restricted QB spline model, and many sensitivity analysis to determine the association between initial renal function decline with study outcomes, which were either a composite of all-cause mortality, major adverse cardiovascular event, and major adverse renal events, or each of these outcomes individually. Kaplan-Meier's curves show the patients with an initial renal function decline greater than 40% had the lowest event-free survival across all outcomes. The composite outcome, all-cause mortality, major adverse cardiovascular events, MACE, and major adverse renal events, MARE. This was followed by loss with a decline of 30% to 40%, compared to loss with a decline of less than 30%. Who had the best outcomes? After accounting for clinical and laboratory confounders, patients with severe eGFR decline had significantly higher risks of poor outcomes compared to those with mild decline. Specifically, they showed a 4.5-fold higher risk for the composite outcome, a 3.5-fold higher risk for death, and significantly higher risk for MACE and MARE. Patients with moderate decline also face increased risks, including a nearly 2-fold higher risk for the composite outcome and a 2.3-fold higher risk for MARE. These findings remain consistent across the subgroup and the sensitivity analysis, confirming the robustness of the results. While using the restricted QB spline analysis to examine the relationship between initial renal function changes and the risks of various outcomes, we observe a clear pattern. As the initial eGFR decline increases beyond 30% to 40%, the risks of adverse outcomes rise sharply. In contrast, smaller eGFR changes, especially less than 30%, are associated with much lower risks. This analysis corroborates the notion that severe initial eGFR decline is strongly associated with worse clinical outcomes. To sum up, An initial eGFR decline of more than 30% following SGLT2 inhibitor treatment is associated with higher risk of all-cause mortality and major adverse cardiorenal events, with the risks increasing when the decline becomes more severe. However, this doesn't undermine the benefits of SGLT2 inhibitor. Instead, it highlights the need for caution, especially in patients with a marked eGFR reduction. The key takeaway message is that clinicians should pay more attention to patients with an excessive eGFR decline of over 30% after SGLT2 inhibitor treatment. These high-risk patients require more frequent surveillance to address potential adverse events. Thank you so much for your listening. I hope you to check our publication in the Mayo Clinic Proceedings. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.